Alright, let's dive into something that's both heartbreaking and infuriating. Health workers in Bunia, Congo, are protesting over unpaid wages right in the middle of one of the fastest growing Ebola outbreaks in history. Yes, you heard that right. While they're risking their lives on the front lines, they're not getting paid. Personally, I think this is a massive failure on multiple levels, and it raises some really uncomfortable questions about how we value the people who literally stand between us and a global health crisis. First, let's set the scene. Bunia is at the epicenter of this Ebola outbreak, which has already seen nearly 4,000 confirmed cases and over 1,800 deaths. To put that in perspective, this is the second largest Ebola outbreak ever recorded, right behind the devastating 2014 to 2016 West Africa outbreak. What makes this really interesting is that Ituri province, where Bunia is located, accounts for nearly 90% of the cases in Congo. So, these health workers aren't just fighting Ebola, they're fighting it in the most critical hotspot. Now, here's where it gets even more frustrating. These aren't just any health workers, they're the ones providing critical care to Ebola patients. They're the ones tracing contacts, isolating cases, and trying to break the transmission chains. And yet, they haven't been paid since the outbreak was declared in mid-May. In my opinion, this isn't just a logistical issue, it's a moral one. How can we expect these workers to keep showing up, to keep risking their lives, when we're not even fulfilling the most basic obligation of paying them? One thing that immediately stands out is the broader context of this outbreak. Congo isn't just dealing with Ebola, it's also grappling with rebel conflicts and mining-related movements that limit access to remote areas. What many people don't realize is that 60 to 70% of new Ebola cases are coming from outside the traced contacts, and most of these are in these hard-to-reach areas. So, even if the health workers were being paid, they're up against a logistical nightmare. But the fact that they're not being paid? That's just adding insult to injury. This raises a deeper question: why are we so bad at supporting the people who are essential to stopping outbreaks? During his visit to Congo, WHO Director General Tedros Adhanom Ghebreyesus urged authorities to prioritize care and support for responders. But let's be real, urging isn't enough. We need systemic change. We need to ensure that frontline workers aren't just applauded as heroes but are actually treated like them. A detail I find fascinating is that officials have blamed logistical issues for the payment delays. But if you take a step back and think about it, these are the same logistical issues that have plagued Ebola responses for years. Why haven't we fixed this? What this really suggests is that we are still not taking global health seriously enough. We are still treating outbreaks as isolated incidents rather than symptoms of a broken system. From my perspective, this isn't just Congo's problem, it's the world's problem. Ebola doesn't respect borders, and if we don't support the people fighting it on the ground, we are all at risk. Personally, I think this protest isn't just about wages, it's a cry for dignity, for recognition, and for a system that actually works. So, where do we go from here? Doctors Without Borders warned this week that the outbreak is still spreading at an alarming rate, and the response isn't reaching communities quickly enough. If we don't address the root issues, like paying health workers, we are just putting a band-aid on a bullet wound. What makes this moment so critical is that it's not just about Ebola, it's about how we value human life, especially the lives of those who risk everything to save others. In my opinion, if we can't get this right, we are failing not just Congo, but humanity as a whole. As we wrap up, I want to leave you with this thought: what does it say about us when the people fighting on the front lines of a global health crisis are the ones being left behind? It's a question that should keep us all up at night. So, let me know in the comments, what do you think needs to change? How can we ensure that health workers get the support they deserve? Because, honestly, if we don't figure this out, the next outbreak could be even worse. Thanks for watching, and let's keep this conversation going.